Okay, so I'm going to start with the medication administration skill check off. Just for reference, you guys are not going to have this paper. I just have it in front of me because it's been a minute since I went through each critical step, and I don't want to miss any critical step for you guys. So yeah, I'm just going to refer to this a lot during this video. So first things first, you're going to assess the number of medications and do the 5 rates on each medication. So I'm going to open it. I'm going to say, today, my patient's name is Henrietta Green. She has 1, 2, 3, 4, 5, 6 medications. By the way, I'm not doing anything below heparin, just for reference, because I don't want to consume too much time. If you guys have any questions on any other medication, make sure that you guys can just text me and I'll make sure to explain everything for you guys. But for this purpose, I just want to run through the entire thing just so you know how it goes. Okay, so the first medication Miss Green is going to be taken at 9 o'clock is lisinopril, 20 milligrams orally once daily. The second medication Miss Green is going to be taken at 9 o'clock is sertraline, 15 milligrams orally once daily. The third medication Miss Green is going to be taken at 9 o'clock is clopidogrel, 75 milligrams orally once daily. The fourth medication Miss Green is going to be taken at 9 o'clock is aspirin, 81 milligrams orally once daily. The fifth medication Miss Green is going to be taken at 9 o'clock is docusate sodium, 100 milligrams orally once daily. And the last and sixth medication Miss Green is going to be taken at 9 o'clock is heparin, 5,000 units twice daily, taken subcutaneously. So it is an injection. So a total of 6 medications, 5 being oral medications and 1 being an injectable. So there you go. You finished your first critical point, assess the number of medications and the 5 rights. And that's how I did it. Next thing you're going to say is the order seems to be complete since you were able to identify all 5 rights of medication for each medication. So the order is complete. So next thing you're going to do is you're going to verbalize reason for admission. So my patient, Henrietta Green, was admitted to the hospital for a hip fracture. She's a post-operative patient and she had a hip replacement surgery. Her medical history contains of hypertension and depression. She has no known drug allergies. I'm going to go down here to orders and I'm going to say she is on a DASH diet. So that's, you just finished the client assessment. She's on a DASH diet. Last thing you're going to do is you're going to go ahead and look at her vital signs to make sure there's no abnormalities. You're going to say temperature within normal range, pulse within normal range, respirations within normal range, blood pressure. She seems to have hypertension, so her blood pressure is a little high, and her pulse ox is 97%. She's currently on oxygen by nasal cannula, 6 liters. Okay, and then you're done with the assessment. So you're done with all of that. Okay, so you're gonna go back to orders, 7 more. So she is appropriate. After seeing her vital signs, you're gonna say it's appropriate for her to take her medications. There's nothing abnormal, it's appropriate for her to take meds. Next thing you're gonna do is you're gonna identify the 9 o'clock medications that will require data prior to administration. So at this point, say for example, there's a medication that says hold for a heart rate below 60. You would go ahead and verbalize that. You'd say, I have a medication here, and then say, for example, it was aspirin. Aspirin, 81 milligrams orally once daily. I need to hold this medication for a heart rate below 60. So I'm gonna have to gather data on that prior to administrating. Make sure you verbalize that. So using the drug cards, you're gonna grab the drug cards you need for each of these. So lisinopril, sertraline, I'm gonna go ahead and, okay. Here, go ahead and do that. So guys, just to let you know, before you even start the medication, before you even start on the MAR, before you start anything, make sure you pull out your drug cards so that way everything is already in front of you. So by the time you reach the planning phase of it, you don't have to be scourging through your drug cards in order to be finding the medications you need. So make sure to grab those before so that way it doesn't mess up your flow, or you don't become forgetful and get nervous and start panicking. Okay, so I grabbed my drug cards before starting. I did the assessment and then planning. So you're gonna go ahead and you're gonna take your drug cards. We identified any medications. In this case, there are no medications that need prior data. So next thing I'm gonna do is I'm gonna state the functional class, expected therapeutic outcome, and the key client teaching. So I'm going to say lisinopril therapeutic outcome is decreased blood pressure and hypertension, decreased preload, afterload, and HF. Teaching point is caution client to rise slowly to sitting or standing position, minimize orthostatic hypotension, may cause dizziness, fainting, and lightheadedness. Functional class is an antihypertensive. Contraindications, you're just going to look at you don't have to say it, but I just said it just for the sake of it. Contraindications, hypersensitivity, angioedema. You're going to go ahead and you're going to go through each one. Sertraline. Functional class is an antidepressant. Therapeutic outcome, relief of depression, obsessive compulsive disorder. I'm going to say the teaching point, contraindications. And then you're just going to go through each one. I'm just going to save it for the sake of time. Okay, pretend like you went through all of them. Okay. So there were no contraindications related to the reported medication allergies, considering she doesn't have any known drug allergies. So next I'm going to go ahead, I'm going to gather the appropriate needles needed. So in this case, we're only giving a heparin injection. So for heparin, you know that you need a 25 gauge needle with a 1 or 3 milliliter syringe. So I'm going to go ahead and grab that 25 gauge needle. And then a syringe right here. I'm just going to keep them on the side here. And then the rest I'm just going to put away because that's the only one we need. Next thing I'm going to do is I'm going to gather anything that I need. So at this point, this is where I grab my alcohol prep. You're going to grab 2 water cups, the little tiny water cups, syringes, your needles, all of that. Okay, so I'm going to perform hand hygiene. For this step, do not just say it. Don't verbalize it. There's going to be a hand sanitizer next to you. Make sure you use that hand sanitizer because they're going to be real mad if you don't use it. Grab hand sanitizer. Okay, cleaning my hands. Then I'm going to go ahead and take the medications after I wash my hands. So I'm going to take, what is it? All right, so I finished getting all of my medications. I have all 5 of the oral medications, and then I have a singular vial. I don't have a new vial, so this is gonna have to do. This is my old one, the heparin vial. Okay, so next, after grabbing all of your medications from your lab bag, you're gonna go ahead and perform your first check. So you're gonna take the first medication. So Miss Green at 9 o'clock has lisinopril, 20 milligrams. Orally, and this is a tablet. The packaging is intact. It's not ripped. It's anywhere. It's not opened, and it is not expired. You're gonna go ahead and do all of that for all of the medications. The thing is, over here, when you see with one of the 3 checks, inspect and verbalize package, try to do that on the first check just to get it out of the way so you don't forget to do it during the second or third check. So like I said, I'm going to start all over, and this is exactly what you're going to do on the checkoff. So Miss Henrietta Green has a 9 o'clock medication for lisinopril, 20 milligrams orally. This is a tablet. The packaging is intact. It's not open, and it is not expired. The next medication Miss Green is going to be taken at 9 o'clock is sertraline, 50 milligrams orally. This is a tablet. Packaging is intact and it is not expired. Next medication Ms. Green is going to be taken at 9 o'clock is clopidogrel, 75 milligrams orally. This is a tablet. The packaging is intact and it is not expired. The next medication Ms. Green is going to be taken at 9 o'clock is aspirin, 81 milligrams orally. This is a tablet. Packaging is intact. It's not open, and it is not expired. Next medication Ms. Green is going to be taken at 9 o'clock is docusate sodium, 100 milligrams orally. This is a tablet. Packaging is intact. It's not open, and it is not expired. And the last medication Ms. Green is going to be taken at 9 o'clock is heparin, 5,000 units. This is a 10,000 unit vial, so this is a multi-vial. Subcutaneously, this is injection twice daily. Okay, and then you're gonna go ahead and look at it, make sure you're gonna have to do the math for this. There's no sedimentation. I see no weird integrity. The vial is intact and it is not expired. And the liquid is clear. So I'm gonna go ahead, I'm gonna do my medication. I'm gonna do my math for this. So I would go ahead, I would do 5,000 units divided by 10,000 units times 1 milliliter equals 0.5 milliliters. So I would have to draw up 0.5 milliliters for the heparin. I'm just gonna have that aside. So I'm done with that. Next, you're gonna do it again. So the first medication Ms. Green is going to be taking at 9 o'clock is lisinopril. Lisinopril, 20 milligrams orally. This is a tablet, once daily. Okay. Next medication Ms. Green is going to be taken at 9 o'clock is sertraline. Sertraline, 50 milligrams orally. This is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is clopidogrel, 75 milligrams. Clopidogrel, 75 milligrams orally. This is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is aspirin, 81 milligrams. Aspirin, 81 milligrams orally. This is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is DocuSay sodium, 100 milligrams. DocuSay sodium, 100 milligrams orally. This is a tablet. And the last medication Ms. Green is going to be taken at 9 o'clock is heparin, 5,000 units. This is a heparin, 10,000 units. So it's a multi-dose vial. I'm going to have to do the math on that, which I already did. Make sure your math is correct. 0.5 milliliters. Okay, I'm correct. So I'm going to administer 0.5 milliliters of that. Next thing you're going to do, which by the way, if you have any medications that need to have prior data prior to administration, you're going to put that in its own cup. So say, for example, the aspirin. Say the aspirin had to have a heart rate greater than, do not give for a heart rate less than 60. You wouldn't check that until the third medication check. In the meantime, after you're done doing your first check and second check, you're just gonna place it in a separate cup on its own. So right over here, okay? So you're not gonna check the actual data and put it in and decide that you're gonna administer it or not administer it until the third check, okay? First thing you're gonna do though is you're gonna ask the patient, what's your name and your date of birth? They're gonna go ahead and they're gonna say it. And while they say it, you're gonna compare it to the band and then from the band to the MAR. And then ask the patient, do you have any allergies? Patient in this case is gonna say no, considering she has no known drug allergies. So at this point, you're gonna do your third medication check off. This is super annoying. It literally takes forever, but it's okay. Just, you got this. Just, it's super repetitive. Okay. So the first medication Ms. Green is going to be taken at 9 o'clock is lisinopril. Lisinopril, 20 milligrams orally, and this is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is sertraline, 50 milligrams orally, and this is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is clopidogrel, 75 milligrams. Clopidogrel, 75 milligrams orally, and this is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is aspirin, 81 milligrams. Aspirin, 81 milligrams orally. This is a tablet. The next medication Ms. Green is going to be taken at 9 o'clock is DocuSay sodium. DocuSay sodium, 100 milligrams orally. This is a tablet. And the last medication Ms. Green is going to be taken at 9 o'clock is heparin, 5,000 units. On hand, I have heparin, 10,000 units. I'm going to go ahead. I'm going to check that. I'm going to say I already did the math. Make sure the math is correct. This is the third time you can check, make sure your calculation is correct. And then you're going to go ahead and say this is an injection and this is an injection vial. So at this point, I do not have any medications that I would have to check for. But like I said, for example, say aspirin, it's set to hold if heart rate is below 60. I would go ahead, I'd look at the vitals. Say at this point, I would check all of the medications and which ones are on hold. So I would go to the vitals. His pulse is at 92. That means we're able to give it to him since it's not below 60. I would go back to the MAR. I would input the number 60. I'm not going to do it on here, but input the number 60. And then you're going to go ahead, you're going to put it in the cup where you're going to administer all of the medications. You're going to put it in the cup and saying that it's okay for me to give this to him considering his heart rate is above 60. Okay. So next you're going to tell him, you're going to say, you're going to say, hello, Miss Green. How are you doing today? Today I have lisinopril. This is to decrease your blood pressure. The next medication I have for you is sertraline. This is for your depression. The next medication I have for you is clopidogrel. This is to thin your blood and prevent strokes and heart attacks. The next medication I have for you is aspirin. This is for your fever, mild pain, swelling. The next medication I have for you is docusate sodium. This is for your constipation. It's a stool softener. And the next medication I have for you is heparin, and this is to prevent blood clots. I would ask the client then, do you have any questions for me? She's going to say no. And I'm going to take all of these medications that I'm going to give to her, the oral medication specifically speaking, and I'm going to put them in a cup all together. I do not have a cup, so I'll just pretend like this is a cup right here. Okay. So next thing you're going to do is you're going to prepare your injections. So let's see where, prepare your injections. Okay. So like I said, I already pulled out the necessary stuff that I needed before I pulled out the medication from my drug bag or drug box. So I pulled out the needles that I needed. So in this case, for heparin, you need a 25 gauge needle. And then you need a 1 or 3 milliliter syringe. In this case, I chose a 3 milliliter syringe. So you're going to go ahead. You're going to open this. You're going to make sure you don't want to touch it. You're going to use the banana peel method. You're also going to open this. This was upside down since I already used it, but it's going to come like this. You're going to want to banana peel this too. You're going to make sure you do not want to touch the actual thing as to keep it sterile. So you're going to banana peel them just like this. You're going to put them together without touching them. Next, you're going to go ahead. There was a blue top on here, but since I've already used this before, I don't have a blue top. You're going to pop off the blue top. This part you're going to want to clean off. So you're going to take an alcohol prep pad. You're going to open this up. You're going to want to clean this for about like 15 seconds or so. Okay, so you're going to pull out your syringe. You're going to open it. Make sure this doesn't roll away. You're going to draw up how much you need. Remember, we did the calculation and she needs 5,000 units. We have a 10,000 unit. We have a 10,000 unit vial. So you're going to pull up 0.5 milliliters. You're going to push up, pull down, and get 0.5 milliliters. I don't know. I don't think you can really see that. 0.5 milliliters. You're going to push it in. You're going to push that air all the way in. You're going to flip it upside down. And you're going to want to, it's kind of hard to balance, but you're going to want to get 0.5 liters. Make sure when you guys are drawing it up, you guys don't touch this part of the needle because that's not considered correct technique. You're going to want to only hold onto this part when drawing it up. So you're going to get rid of any air bubbles. And you're going to go exactly to 0.5. You're going to do the scoop method. So you're not just gonna grab the cap and put it on. That would be considered incorrect technique. You're gonna wanna put this against something, and you're gonna wanna take your needle and you're gonna wanna scoop it up right here. Just like that. I don't know if you guys were able to see that. Let me do it again. So it's pressed against my computer right here, just so it has something to hold on to. You're gonna wanna put your needle in without touching the cap. And you're gonna wanna scoop it up so that way it closes just like that. And then you're gonna go ahead, you're gonna take a label, and with the label, you're gonna wanna put what it is. So we're gonna do heparin, and then 0.5 milliliters, 5,000 units. And then you're gonna go ahead and place it right here. You're gonna label it, but do not cover the 0.5 milliliters just so they know, or the instructor can see how much you pulled up, and make sure you're correct. So if you're gonna stick the sticker on it with the information, make sure you do it below, so they're able to see how much you pulled up. You're gonna give it to your instructor. They're gonna go ahead, they're gonna make sure you did the right amount. Okay. Now you're ready to give everything, to give all your meds. Okay, so next you're gonna administer your oral medications. So right here, you're gonna be like, you're gonna ask the patient, would you like me to assist you up into Fowler's position? And then do you have a preference as to how you would take your oral medications? Do you want any liquids? Do you want water? Anything you need? No? Okay, so you're gonna go ahead, you're gonna give them the medication, you're gonna place it in a cup. You're not gonna have to open the medications. You don't have to like unwrap it and like do all of that. Just put all of these as it is in a cup and just give it to the patient, just like that. Be like you gave it to the patient. When the patient is done with the medications, you're gonna ask the patient to open their mouth and you're gonna inspect their mouth to make sure they did swallow their medications. So now you're done with the oral meds. Next thing you need to do is your injectable medication. So first thing you're gonna do is you're gonna go ahead and you're gonna say all of the sites for the subcutaneous sites. So what are the 5 subcutaneous sites? I wrote all of them down right here. If you guys do not have this paper, I can go ahead and send it to you, but this has just like all of the syringes and the needles you need for each medication. You have to memorize this, you have to know this from your head. So say for example, you're given a vaccine, you have to know what gauge, what, and all of that, you know? So let me know and I can send you this paper. So you're gonna go ahead and you're gonna name all the sites. Subcutaneous sites, we have the abdomen, below the costal margin to the iliac crest, at least 2 inches away from the umbilicus. The next area we have is the upper arm, the upper posterior aspect of the upper arm, the thigh, the anterior aspect of the upper thigh, the scapular area of the back, and the upper dorsal gluteal regions. Those are the 5 regions that you need. So you're gonna have to choose one. Make sure you tell her which one you're gonna use for this. So in this case, we're gonna say, let's do the abdomen. Say we'll do the right upper quadrant of the abdomen. Right upper quadrant of the abdomen, okay. Next, you're gonna name all the IM sites. So the 3 IM sites are the deltoid, the vastus lateralis, and the ventral gluteal. You're gonna have to explain how you can find these sites. So for the deltoid, you're gonna go ahead, you're gonna spot where the acromion process is, you're gonna put 2 fingers below it, and you're gonna create a little V right here, and the little V in between is where you're gonna have your injection. You're gonna do vastus lateralis and ventral gluteal. I can send you guys the videos so that way it don't take too much time right here. I'll send you guys videos as to how to locate those things. And plus I don't have anybody to do it on, so. Okay, and then we have that. So now you're gonna go ahead, you're gonna put on your gloves. Put them on. And then for this, since we have heparin, I'm gonna say, since it's a subcutaneous site, I'm gonna go ahead and I'm gonna inject that in the abdomen, the right upper abdomen. So I put on gloves. I don't have an AirPad, I just realized that. Okay, so I said all my locations, put on gloves. I don't know what I'm gonna inject this into. Okay, so after you're done verbalizing all of your subcutaneous and IM injection sites, you're gonna go ahead and you're gonna put on gloves. So they're gonna have a glove box in front of you. You're gonna go ahead and take it. and you're going to put it on. So before you even inject, you're going to make sure you're going to want to say where you're injecting your medication. And this is before you even open the cap, before you inject. Make sure you verbalize it before. So in this case, we only have a heparin. We know that a heparin is a subcutaneous injection. So we have 5 places we can inject it into. In this case, I'm going to say I'm going to inject it in the upper posterior aspect of the arm. So I'm going to go ahead. I'm going to inject my heparin in the upper posterior aspect of the arm. I'm going to go ahead and open that. Remember, I have my gloves on. Pretend I have my gloves on. And for heparin, you're going to want to pinch. You're going to want to put it in quickly and inject. Notice how I'm still holding that pinch even after removing. You're going to pinch, put your needle in, keep it pinched, then remove, and then let go of the pinch. And this is specifically for heparin. You're going to engage the safety needle. You're going to engage the safety needle, and then you're going to discard of it. You're going to discard of it in the sharps container. If you had another injection, say for example, we had an IM injection, you're going to go ahead, you're going to take that, and you're going to take it, and you're going to say, I'm going to inject this into the deltoid, and say this is a vaccine. You know, for a vaccine, you're supposed to spread the skin. For vaccines, you spread the skin, and then you're going to inject, and you're going to remove, and then you're going to let go. For non-vaccines, you're going to Z-track. For Z-tracking, you just take the skin, and you kind of like swipe on it, stick in the needle, inject it, and then let go. Okay. All right. And then now that that part's done. So after you're done with everything, you're going to ask the patient, do you want me to assist you into a more comfortable position? They're going to sit and see what they say. You're going to take all of the trash in front of you. You're going to have a lot of trash in front of you. Take all of the trash. This is already thrown in the sharps container as soon as you finish. You're not going to wait and throw it with the rest of the trash. Throw it immediately into the sharps container when you're done. I'm going to throw everything away, and I'm going to take off my gloves and make sure your hand sanitizer is there. You're going to clean your hands with the hand sanitizer. So you're going to ask the patient again, do you have any discomfort, or do you have any questions for me? Explain that you're going to be back to evaluate the medication response, or to check their pain levels. You're going to ensure the bed is in the lowest position and locked. Ensure the 2 side rails are up. The call light is within reach. Ask the patient again, are you comfy? Do you need anything from me before I leave? They're going to say no. And then you're going to go ahead and you're going to document everything that you need. So lisinopril, RA, for المفلحي. You're going to say that you documented it, RA for that, RA. And then for the heparin, we said that we were going to inject it into the upper aspect. Right here in the upper posterior arm. So right upper posterior arm, right upper posterior arm. And then down here, you're going to go all the way down here. Initials are going to be RA. You're going to write out your name, Rawiya Al-Muflahi. And then you're going to write SN for student nurse. And then you documented all of that. So yeah, so you're done. So you're done with it. And that's how it goes. They're going to just know for these, they're not going to expect you to know all of them. You're going to have to know all of them either way, because they're going to choose a random one for you to know. They're not that hard. They're very, very simple to memorize. But yeah, and then you're done with everything. So trying to think what other advice I can possibly give you guys. If you guys didn't understand anything or need me to explain anything a little further, please let me know and I'll try. I'm sorry this was kind of like all over the place. I just came back from like a really long day and I'm like all over the place. I have so much homework and stuff. So I'm sorry if this wasn't as clear as you hoped it would be. If you have any questions, you guys always know you guys can text me. You guys can let me know if you guys need me to clarify anything. But yeah, I think for the most part, that's it. The only things I would recommend for you, honestly, would be to, before you even start seeing how many medications your patient has, and if the order is complete, I would go ahead and I would pull out all of my medication cards and put them in the side, like all the correct medication cards in the side, so you don't have to be like looking through them later down and like kind of ruin your flow, if that makes sense. And then I don't know if you guys have my medication cards. Let me know if you guys don't. I'll send them to you. But these are what you're going to want to say. You're going to want to say the therapeutic outcome, the teaching point, the functional class, and then the contraindications. I read it out. You don't have to, but I just read it out just so they know that I'm looking at it, you know? And then later when I tell the patient what each medication is for, I just wrote this in the bottom to help me out. So to decrease your blood pressure, or this is for your blood pressure. So yeah, okay, I think that's it, honestly. All right, if you guys have any questions, comments, concerns, let me know. If you guys didn't get this paper, let me know and I'll send it to you guys. This just says all the subcutaneous sites. And it says the syringes for insulin, non-insulin that you need to memorize. It also tells you how you're supposed to, like, if you're supposed to pinch the skin, if you're supposed to Z-track, if you're supposed to spread the skin. So just let me know and I'll send this paper to you. Okay, I think I'm done. All right, bye guys.